Welcome to Doccla.
Welcome to Doccla.
Welcome to Doccla.
We have an ageing population. Everyone knows that. People are getting older, and that means they're going to be having contact with hospitals much more. So the demand on hospitals is going to increase for years, if not ever to come. With that, we then have the issue of staff. So you've got an increasing demand, and then you've got workforce leaving the NHS at its biggest percentages that we've ever seen.
I mean, we exist to keep patients out of hospitals. We deliver this as a complete end-to-end service.
Remote patient monitoring gives patients a sense of control and dignity.
Patients often say they recover better in their homes because they're surrounded by their support bubbles. So for us to allow a patient to recover and be monitored in their own home, we're actually allowing a patient to recover faster in a setting that is more familiar. So that's really what we mean by being able to support any type of pathway.
So first the patient will be referred at the hospital, then they will go home and they will receive their kit. The kit contains the devices that are relevant to the pathology of the patient. Once they receive the kit, we will then get in touch with the patient to ensure they know how to use it and will welcome them to Doccla.
So a lot of suppliers, they just come at it from a hardware perspective and a software perspective. So they essentially will sell the hospital a bit of software, sell the devices, maybe do a little bit of implementation support, and then that's it. Why should they choose Doccla? Well, we do things a little bit differently. We hold our clients' hands all the way through the implementation and the business as usual as well. We support the whole process of building that pathway, training them, whether that's in-person training, hybrid training. We're on site a lot.
At Doccla, we have our own warehouse with our experienced staff, our system, and we take care of packing all the equipment for the patients, calibration, decontamination. We then ship all the kits to the patient and collect them when they are safely discharged.
People think it's going to be complicated and slow and tedious. And what I would say to them is we know how to move at pace.
With our clinician dashboard, a clinician is able to have confidence in the monitoring that they're able to provide to their patients. This allows a clinician to prioritize their workload. And the way we do it is that we surface this as soon as the clinician logs in, so it's front and center and it's impossible to miss when a patient is unwell.
So what makes us incredibly proud at Doccla are three statistics, really, when I think about it. The first is our patient satisfaction. So depending on the pathway, that can sit anywhere up to 99% of patients say that we're good or really good, and that's extraordinary in any industry, but particularly so in healthcare.
We at Doccla have a really stringent escalation process that we've put in place. Any action plans that need to happen as a result of it, and we also take away learning outcomes.
Every week we receive letters from the patient to say how grateful they are that Doccla has been able to step in and enable them to recover from the comfort of their home.